Hello everyone, this is Dr. Sangeeta Chaudhary and once again I welcome everybody to my lecture class. In my today's class, I am going to discuss about various non-invasive ways of oxygen therapy. We know that delivery of oxygen is a very important modality during different type of lung diseases and even cardiovascular diseases. So we really need to know how do we deliver oxygen via different devices and how much we should give oxygen. So let's discuss. So these are the delivery system or devices with which we can deliver oxygen to a particular patient. We can use nasal cannula, which is most commonly used. Then we can use simple face mask, venturi masks, non-rebreathing masks, high flow nasal cannula, and non-invasive positive pressure ventilation. So let's discuss one by one. Nasal cannulas. So nasal cannulas, as I said, these are most commonly used for the delivery of oxygen to a patient. But the thing is that the exact amount of FiO2, that is fraction of oxygen in inspired air delivered, remains unknown because it is highly influenced by the peak inspiratory demand of the patient. Each additional liter of flow increases FiO2 by 4%. That we can remember. And the rate of oxygen flow should be limited to 6 liter or below, not more than that, by nasal cannulas. Next is simple face mask. Now, in the simple face mask, they deliver FiO2 of 35 to 55%, and flow rate usually we can deliver 5 to 12 liter per minute. This we need to remember. Now, venturi mask. What is the difference between venturi mask and simple face mask? Venturi mask, actually with the help of this we can deliver a precise amount of FiO2. So precise administration of oxygen is possible via venturi mask. We can control the amount of FiO2 we want to deliver. So different FiO2 delivered by venturi mask can be 24%, 28, 31, 35, 40 and 50%. By simple face mask, of course, we can deliver FiO2 in between 35 to 55, but exact controlling or exact amount of FiO2 which we want to deliver cannot be precisely, established, right? Which can be done via venturi mask, that is precise administration of oxygen. Now, next is non-rebreathing mask. In non-rebreathing mask, one reservoir bag is used where oxygen is first reserved. So it results in high concentration of oxygen in the inspired air. Flow rate can be adjusted to in between 8 to 15 liter per minute. And there will be a one-way valve in the non-rebreathing mask in the reservoir bag so that the expired air cannot enter the reservoir bag. So this is about non-rebreathing mask. Now, heated, humidified high flow nasal cannula. HFNC stands for high flow nasal cannula. So with this thing, heated and humidified oxygen can be delivered at a high flow rate so that it can displace some of the air which contains less oxygen in the airways. This system can deliver up to 60 liter per minute flow rate and 100% FiO2. It can also provide small amount of PEEP at high flow rates, right? So this is about the high flow nasal cannula. It has been seen that in various studies, it is when high flow nasal cannula is used, it can improve the morbidity and even sometimes the mortality rate can also be reduced in patients. Lastly, NPPV, that is non-invasive positive pressure ventilation. Now, it can provide respiratory support with positive airway pressure, as the name suggests, positive pressure ventilations. So, it can provide positive airway pressure with the help of a sealed face mask or maybe nasal mask or a helmet device. Non-invasive positive pressure ventilation can be of two types, that is continuous positive airway pressure and bi-level positive airway pressure. So I'm going to discuss about NPPV in the next upcoming classes. So for today's lecture, up to this much I wanted to discuss. I hope this was helpful. It's very helpful for practical purposes for medical students also, and as well as those we who are treating doctor. It's very beneficial for us to know about different delivery devices when we need to deliver oxygen to a particular patient, and how much we need to keep the FiO2 and at what rate we need to give oxygen supplementation. These are all very important. So thank you so much for attending the class.